Welcome back to the Gee and Ursula Show, Tuesday morning edition. So after a 2-week hiatus, our favorite virologist, Dr. Angela Rasmussen, is back, and she joins us now on the Gee and Ursula Show. Good morning, doctor.
Good morning, Ursula.
We missed you, I got to say.
Whoa.
I know, I missed you too. I can't believe it's already been 2 weeks.
Yes.
We need help.
Yes. So you heard that the CDC just announced that fully vaccinated people in the U.S. no longer need to wear masks outdoors, in small groups, when biking or running alone, and when dining outside. Yet we know that cases in many parts of the country are going up. Why is the CDC doing this now?
Well, I think it's for a couple reasons. One is that really what the data shows us. And the data shows us that even people who are not vaccinated are much less likely to be exposed to SARS coronavirus 2 in an outdoor environment. The risk of transmission is not zero outdoors, but it is reduced significantly. If you were vaccinated, fully vaccinated, then you are really, really protected when you are in those outdoor environments. And second of all, I think that it's good that the CDC is cautiously lifting more and more restrictions for people who are vaccinated, both because the science continues to show that these vaccines are very safe and very effective, and we should be incentivized to get vaccinated because it does allow us to return to what I think many of us would call, quote unquote, normal way of living our daily lives.
All right, Dr. Rasmussen, I got a few questions from the listeners since you've been gone for so long. Okay, I'm exceptionally nervous for my vaccine today. I'm 29 and I'm on birth control. Do you guys know the blood clot rate for 3 Moderna and Pfizer? For the three, Moderna, Pfizer, JJ, all that stuff.
So for Moderna and Pfizer, nearly 200 million doses of those vaccines have been delivered, and there is no safety signal associated with blood clots or anything else for those vaccines. So there is no known risk of having a blood clot with either the Pfizer or the Moderna vaccines. With Johnson & Johnson, there is a risk, and I will say to the questioner that I personally have had the Johnson & Johnson vaccine 3 weeks ago today. I also previously took hormonal birth control pills for over 20 years, beginning when I was a teenager. And your risk of having any kind of blood clot from hormonal birth control is actually much higher than it is for having one with the Johnson & Johnson vaccine. The Johnson & Johnson vaccine has been associated so far with 7 cases of this particular type of blood clot. And this is not just any blood clot. It's a very specific type of blood clot that's also associated with a low platelet count, which is somewhat unusual. So this is not just having a blood clot. This is a very particular type that seems to be associated with this vaccine in extremely rare cases. So it's still not known if this primarily affects women or younger people, but it does suggest that if it happens, at most, it's happening in about 1 in every 250,000 cases. So again, your odds, if you feel that you are going to get a blood clot from the Johnson & Johnson vaccine, are much better, actually, if you go out and play a scratch ticket or buy a lottery ticket. I think that people really should understand that the risk of those happening is very, very low. And now that people are aware of it, should you have any of the symptoms of those severe types of blood clots, usually that's a severe headache, then you should go to the hospital immediately, and your physician there will have a better idea of how to treat you if you tell them that you've just gotten the Johnson & Johnson vaccine. But personally, as somebody who did receive this vaccine, I feel overwhelmingly happy to have gotten it because the chances of me getting COVID and getting a blood clot from COVID are actually much, much, much higher than from getting the vaccine. I'll take the benefits over the risks of the vaccine any day.
Dr. Rasmussen, as the governor is expected to announce potential rollbacks coming up on May 3rd, there are critics who say, why is it that these other states that have reopened, Texas, Florida, et cetera, and they've relaxed the rules on masks and they've reopened businesses. Why are they doing so much better in terms of COVID case numbers than we are in Washington? What is your response?
Well, my response is that it's not just as simple as lifting restrictions, because people in Texas, people in Florida are different than people in Washington. We live in different communities. Our communities are comprised of different people who are at different risk levels for COVID. We have different amounts of COVID circulating, not just statewide, but in various communities. We also have different weather that allows us to do different behavior. In Florida and Texas, for example, people are able to be outdoors, especially earlier in the year, a lot more frequently than they are in Western Washington, certainly, and Eastern Washington, where it's much colder and much less pleasant sometimes to go sit at a cafe for hours and hang out with your friends. So I think that people need to understand that this is not just one thing. It's not just a mask mandate. It's not just restaurant capacity. It's not just how many people are going to go engage in those activities. There are so many different factors that contribute to overall transmission within a community. We should be worried about our own communities and less about what other states are doing. I think that in Texas and Florida, I'm glad that they haven't had as much of a problem. But in certain communities in Florida, for example, there have been increases in cases. It just hasn't been reflected in the statewide data. So people really do need to consider that it's not always just as simple as looking at total cases in a given state overall with regard to individual policies that state may have. These are much more complicated issues than that.
Here's another question from our listener. Is the vaccine really as effective as we have been told? Is there any data reports that have been done? If the state is actually 50% vaccinated, talking about the state, if it's 50% vaccinated, it just seems to me like the numbers don't add up.
Well, I don't really know what that means, but the vaccines are very effective. The thing is, they are measured from after the time a person has been vaccinated, fully vaccinated, 2 weeks after their second shot. And in the case of Johnson & Johnson, it's probably more like 3 weeks after that one shot. So when we look at overall case trajectories and we look at the number of people who've been vaccinated, 50% of people seems like a lot, but not all of those people have been fully vaccinated. They're not necessarily the right amount of time out past their second shot. And also, there are groups of people congregating together, specifically younger people, who are not yet vaccinated. And that is who we, in many states, are seeing transmission primarily in. Transmission has now shifted to younger populations where people have not had as much access to vaccines, where people have not gone through their full vaccine regimens, because those are the people that are still susceptible. And the people who have been vaccinated, transmission has been drastically reduced, as have hospitalizations and deaths.
Dr. Rasmussen, you've read the reports that there are millions of people who've had their first dose but are either refusing now to get that second dose or just haven't made their appointments, whatever the case may be, but they're at risk of not being fully vaccinated. What can you say to someone who is in that position right now to convince them to get that second dose?
Well, I think it really has to do a lot with the reason why they haven't gotten a second dose. For some people, I think we still have not done a good enough job of making vaccines accessible to everybody. Not everybody has a car. Not everybody has the means to get out and get to that place that is going to give you that second dose. Not everybody has the ability to navigate the sometimes complex websites that are required in order to schedule your dose. I know I certainly had a lot of trouble with that when trying to book doses for myself and my husband. So there are reasons that people can't access those second doses in some cases. Some people had bad reactions after their first dose, and they may be concerned that they're going to have an even worse reaction after their second dose. And for those folks, I would just really recommend that they reach out to their healthcare provider and talk to them about their concerns and their worries. In some cases, maybe people are worried about, will I have to take time off of work if I get really sick after my second dose? That's something that at the state level, we need to do better, actually at the federal level as well. We need to provide people the support in terms of paid sick leave that they need in order to not only get the vaccine, but to then have time to recover if they do have those unpleasant side effects. The side effects are not permanently harmful, and I think many people have made the calculation that it's worth it to avoid getting COVID, but not everybody can do that. Some people can't take time off of work, so we need to make it more possible for those people to do that, and we need to make sure that we are answering people's concerns about what happens if it's unpleasant when you take your second shot. And then there are a number of people who might feel that for medical reasons, they don't want to take their second shot. And again, for those folks, I would recommend really strongly that they talk to their healthcare provider, because not everybody can take vaccines. That's why it's so important that everybody who can take vaccines actually get them.
Yes, absolutely.
Thank you so much, Dr. Rasmussen. There's so many more questions we want to ask, but we'll just have you back again next Tuesday, my friend.
I'll be back next Tuesday, and I'll say hi to my dad.
Say hello to Taz. Thanks a lot, Dr. Rasmussen.
You bet, Gee. Take care.
Hey, coming up